Now we will see about the pathophysiology of the ventricular septal defect. As left ventricular pressure is higher than the right ventricular pressure, the blood moves from here. The left ventricular pressure is more than the right ventricular pressure, so the blood moves from here to here, so that the left to right, leading to the increased blood flow through the pulmonary vasculature from here to here, so that the increased output of blood flow to the pulmonary vasculature in long run. It happens for a long time. When in that time there is increased right flow lead to the pulmonary hypertension. Due to the increased right flow from the left to right, there is increased blood flows always, so that for long period of time, in some point of the time, there is increased pulmonary hypertension in the right side, and there is increased right ventricular pressure. There is increased right ventricular pressure also, so that the right ventricular pressure may be equal or more than the left ventricular pressure. The pressure first left side it is more high, so that the blood flows from the left to right. Now here the right side is so high, so that the blood gets reversed and reverse the shunt. It is known as a result the shunt is reduced and reversed, and this causes central cyanosis may develop in this ventricular septal defect. The clinical features of this ventricular septal defect are small VSD are asymptomatic, and 90% them closes spontaneously by 10 years of age. The small ventricular septal defect are asymptomatic, and 90% of them closes spontaneously by the 10 years of the age. Moderate and large ventricular septal defect leads to pulmonary hypertension. This moderate and large leads to the pulmonary hypertension and causes exertional dyspnea, the difficulty in breathing, and chest pain, syncope, and hemoptysis. When there is the reversal of the shunt from the right to left, it causes central cyanosis, clubbing, and polycythemia. Cyanosis, that is bluish discoloration of the nails and the skin. Clubbing, swelling of the limbs, fingers. Polycythemia. In the CVS examination reveals cardiac enlargement and prominent apex beat. In CVS examination, there are two things which are revealed. There is cardiac enlargement and the prominent apex beat. The complications of this ventricular septal defect are congestive heart failure, which is congestive cardiac failure, pulmonary hypertension, infective endocarditis, right ventricular tract outflow obstruction. These are the complications seen in the ventricular septal defect. The investigation are there is increased pulmonary outflow and increased pulmonary hypertension, right ventricular hypertrophy. These are in chest X-ray we can see these things, which are increased pulmonary outflow, increased pulmonary hypertension, right ventricular hypertrophy. In ECG there is left and right ventricular hypertrophy is seen. In Doppler there is abnormal flow is seen. In 2D echocardiograph confirm the presence and size of the location of the VSD, ventricular septal defect. The treatment for this ventricular septal defect are surgery is not recommended for the patient with small shunts and normal pulmonary arterial pressure. The surgical corrections of the moderate and large VSD before the development of the severe hypertension is required. After it develops, then it results in we can reverse the process, or there will be reoccurrence after the surgery. The surgery is not recommended for the small ventricular septal defect. It is recommended for the moderate as well as the large one. We should do the surgery before it goes to the severe hypertension. When it gets severe, it cannot be reversed or may progress after the surgery. These are the treatment for this ventricular septal defect. Thank you. If you like this video, please like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. I will provide this note in the Medicine Note YouTube Instagram page. Please do follow that for the notes. Please to support that too. Thank you.